We begin with the wait for the first doses of a coronavirus vaccine. Today, the CDC is holding an emergency meeting to discuss who will be the first to get one when one is approved. Now, this comes as more than 157,000 cases were reported just yesterday, marking the 28th straight day of at least 100,000 cases in the U.S. And more than 96,000 people are in the hospital getting treated for COVID, another record. So Deborah Alfarone is in Washington. Deborah, the big question is, how soon can we expect doses of the coronavirus vaccine to be made available?
Well, Anne-Marie, they could be coming out in just a matter of weeks, and it really depends on what category you fall into. It is expected that healthcare workers will be the first to see doses, and after that, the elderly. Today, the Centers for Disease Control is holding an emergency meeting to recommend who should get the coronavirus vaccine first.
Vaccinations? That is going to be the weapon that will end the war.
Governors will have the final say, but the CDC is expected to prioritize the elderly and healthcare workers.
Of course, with the positivity rates being high, we have both staff members, nursing, as well as ancillary staff members that are in quarantine.
If the FDA approves vaccines from Moderna and Pfizer, 40 million doses could be shipped out this month.
This is going to be one of the most challenging public health distribution efforts we've seen. It's going to be hard to imagine this going off without a hitch.
It will take months before vaccines are widely available to the public.
The challenge is going to be to convince people to get vaccinated.
Dr. Anthony Fauci told Facebook CEO Mark Zuckerberg he hopes at least 75% of the country gets vaccinated.
By the end of the second quarter of the year, you could have enough protection in this country that the pandemic as we know it will be well suppressed below the danger point.
Facing record hospitalizations right now, some governors are considering new restrictions to slow the spread.
If these trends continue, we're going to have to take much more dramatic, arguably drastic action.
In Rhode Island, hospitals are full for the first time. Patients are now being sent to field hospitals for care. And health experts say don't let talk of a vaccine stop you from taking precautions. Wearing a mask, social distancing, staying away from other people, really, because they say we're heading into a long, dark winter, and those case numbers, they are expected to rise, Anne-Marie.
Yeah, I know. That's the important but concerning information moving forward. Deborah Alfarone in Washington. Deborah, thank you so much. So we're getting a closer look at the challenges of distributing a coronavirus vaccine. DHL is handling international shipments of the vaccine. The Pfizer treatment must be kept at negative 94 degrees, and it's shipped in specialized containers cooled by dry ice.
Every box will have a monitor that goes with it, so we'll be able to monitor not only the temperature, but where the shipments are going.
United Airlines flew its first shipment of Pfizer's vaccine last week. A science advisor to President Trump has